Well, it's a treatment touted as slashing recovery time and improving outcomes for women undergoing breast cancer surgery. According to leading breast cancer surgeon, Associate Professor Sanjay Warrier, wound healing has been one of the most critical and underestimated aspects of surgery until now. And Sanjay joins me now. Sanjay, thank you and good afternoon to you. Advanced wound technologies are promising faster healing and fewer infections. Tell us how it works.
Thanks, Ursula, firstly, for having me. Yeah, it's really interesting because historically, as surgeons, our focus has been on putting in the sutures right, making sure the wounds are closed appropriately, evolving our technologies in the operation. But a large part of healing is really just making sure we get that post-operative care right. And what this dressing does, it effectively provides negative pressure on the wound. So it's suctioning at the wound. And what that does is leads to better blood flow and it leads to better outcomes.
A lot of people forget about the importance of post-operative care. Just how much of a difference will this make?
It's huge. The reality is it's an active management system. It's not a passive system, and it makes a huge difference because it's probably taking tension away from the wound. It's improving a number of factors that happen after we operate and therefore allowing for people to recover quicker, have less likelihood of infections and less likelihood of wound breakdown. So it's been fantastic.
And so what results have you seen?
Yeah, we've seen fantastic results across the world, to be honest. There are now over 60 randomised control studies in every type of surgery demonstrating better outcomes with using this technology over standard dressings. And we see the highest benefit in patients that have higher risk, whether it's their risk or the type of operation. But definitely, it's been across the board improvement in outcomes for patients by using these dressings.
So not only are women getting back on their feet faster, but there's also cosmetic outcomes that are improved. That's incredibly important to people's mental health, isn't it?
Yeah, definitely. I think a cosmetic outcome is impacted by how it heals early. And if you get it wrong early, you're going to likely end up with a poorer aesthetic outcome. So, and then ideally, anyone going through surgery, they want their scars to fade. They want them to heal as good as possible. And so they're not getting the reminder of having to go through that treatment. And so that's been fantastic for us.
Well, Associate Professor, thank you so much for joining us today.
Thanks, Ursula. Nice to chat.